Well, we could start with introductions. What do you think?
Go for it.
Just to get ourselves moving along. All right, Teresa, you spoke. You get to start.
I'm Teresa Olander. I'm a CAC representative. I live in Bend. Pronouns are she, and no, she, her, and hers. There we go.
No, we're doing CAC members first, right? That's our new. How about Connor?
Hey, this is Connor Carlson. I'm a CAC member and grew up in Bend and moved away for a while and have been back for about 2 years now.
Thanks, Connor. Mandy?
Hi, everyone. Mandy Seeley. I use she, they pronouns. I'm in Sisters, and I'm a CAC consumer rep.
All right. Thanks, Mandy. Elizabeth?
Hi, I'm Elizabeth Schmidt. I'm a CAC member. I live in Bend, and that's me.
Thanks, Elizabeth.
Thanks.
So who's our sixth member? I'm seeing 1, 2, 3.
I may have miscounted.
Okay.
There's only 5, yeah.
Well, I'm Brad Porterfield, the CAC chair, live in Redmond, consumer rep, and that's enough about me. Who's next? Would the staff like to help do the rest? I forget our new order.
Yeah, I'll help out. Next, we're going to do our support staff. We'll start with Michaela and then go to Gwen.
Hey everyone, Michaela Arsenault, project manager at the Central Oregon Health Council, and my role is co-CAC coordinator with Gwen, and so her and I help support the CAC behind the scenes and push projects along.
Thanks, Michaela. My name is Gwen Jones, she, her, hers. So glad to see you all today. I'm a coordinator alongside Michaela, and we help out with the things like putting the documents together that y'all get, slides, and communication and coordinating the conversations that happen in the meeting.
Donna, let's go to you.
Hello, everybody. Good afternoon. My name is Donna Mills, and my pronouns are she, her, and hers. I serve as the executive director to the Health Council, and so my role here is to continue to support the staff so the staff can support you.
And hi, everyone. My name is Kelly Adams. I'm providing admin services to the Health Council, helping out Gwen and Michaela for the CAC. And next, we're going to go to our other Health Council members, Camille and then Renee.
I'm Camille Smith. I provide administrative support at the Central Oregon Health Council. So I support Donna so she can support the staff so they can support all of you.
Hi everyone, Renee Worth. My pronouns are she, her, and hers, and I am a project manager with the Central Oregon Health Council along with Gwen and Michaela.
Great, let's move to our other guests for today. On the phone, we have Buffy Hurtado. Go ahead, Buffy.
Sure. I'm Buffy Hurtado. I'm an enrolled member of the Confederated Tribes of Warm Springs, and I serve as the tribal liaison for Pacific Source.
Great. Next, we'll do Carolyn and then Rebecca, please.
Hi, Carolyn Black, pronoun she, her, hers. I am an outreach and education coordinator serving Central Oregon. I'm with the Oregon Health Insurance Marketplace.
Hi, good afternoon, everyone. I'm Rebecca Donnell. I'm an innovator agent with the Oregon Health Authority. Pronouns are she, her, hers. And I saw the question, who are you grateful for? And I'm grateful for my husband.
Thank you. Next, Tanya and then Kristen.
Hi, everyone. Tanya Curiel. I'm the Regional Outreach Coordinator for Central Oregon with the Oregon Health Authority's Community Partner Outreach Program, and I live in Redmond.
Hi, I'm Kristen Tobias. I use pronouns she, her, hers, and I am the community health coordinator for Pacific Source Community Solutions. And I come to the CAC meetings to listen and learn from all of you and your experiences and take that information back to Pacific Source. And I also sometimes bring some tasks to you all as well. And I live in Bend.
Thank you. And then we have Trisha and then Stacy, please.
Hello, everyone. Trisha Wilder, she, her, and hers are my pronouns. I'm the director in Central Oregon of the CCO. I'm grateful for Kristen, and I'm here to support all the great work being done in this space.
Great, thank you. And then we had Linda Johnson jump on. Linda?
Sorry, we
Hi,
jumped
Linda
past Stacy.
Johnson, community member at Central Oregon Health Council.
We jumped over Stacy.
Oh, sorry, Stacy, go for it.
That's okay. Can you guys hear me?
Yes.
Okay. My name is Stacy Shaw. I am here as a guest as a community member. I'm currently a college student, and I also just switched my degree to public health. So I come to these meetings to learn and be a part of, hopefully, the community and supporting my new degree.
Okay, I think that is everyone. Did I miss anyone? Great.
All right, and I saw in the chat that Regina, our other CAC members, Regina Sanchez with Cook County Health Department, let us know she won't be able to make it. Larry Kagosic, is that how you spell Larry's, pronounce Larry's last name? Kagosic?
Yes.
Larry. Also let us know he won't be able to make it. And Elaine from Mosaic, let us know she won't be able to make it. What else are we missing? Ken Wilhelm, United Way.
We just got notification that from Gina via email that she won't be here.
Okay. I'm trying to remember, I'm spacing out our CAC member's name from Deschutes County Health Department.
Tom.
Tom. And Ken just logged in.
Oh, Ken just logged in, okay. Tom, yeah, Tom. All right, well, let's let Ken, would you like to introduce yourself briefly, Ken?
Sorry, Brad, were you talking to me?
Yes, go ahead and just introduce yourself.
Yeah, good afternoon, everybody. Sorry I'm late. Ken Wilhelm with United Way when I'm not serving as a member of the CAC. My pronouns are he and him.
Thanks, Ken. And does that get us to a quorum or no? Still not. One short.
That gives us 7, which we need 8 for a quorum.
Okay, we'll see if somebody else joins if we do need to vote. But let's go ahead and turn off my phone. And I will love to read the land acknowledgement, but again, I think I mentioned last time, I would love for other CAC members to volunteer in the future to read the land acknowledgement, so it's not just always me, but I'm happy to do it. So we recognize and acknowledge as the Community Advisory Council, the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children. And I hope I pronounced all the tribes correctly, or be sure to let me know if I don't. And if somebody would like to volunteer to read the land acknowledgement next time we meet, that would be fantastic. All right, we can do that at our next meeting. But let us know offline, let Michaela know or me know offline if you'd like to be the one to read the land acknowledgement next time we meet. Next, we have public comment and patient story. So is there anybody who would like to make a public comment or share a patient story?
I would like to say thank you
Please
to
do.
Brad and Michaela for reading my story at the combined meeting last week. Was it last? It doesn't matter when it was. That was really helpful for me. It was really difficult for me to write. It was really difficult for me to get clear and concise and not have people check out. But I really appreciate you guys taking it on and reading for me, because a lot of that stuff triggers me. And I would also, and then I get upset and I sound like a bumbling idiot. But I also wanted to put out there that I'm okay with you guys sending it to whoever you think would be helpful. Not only to me, but to OHP members in general. That's the big goal, to make things better for everyone so it's not so cumbersome and exhausting and frustrating and triggers other things, because I cannot be the only one. Anyway, kudos to you. Thank you so much.
Thanks, Teresa. And all we did was pass along your hard work and your experience that you took the time to put on paper, which is fantastic, so that it can be passed on easily to others. Did you want, and I don't know if it was ever shared with CAC members, did you want to share it with all the CAC members if it hasn't been shared with CAC members?
Sure, it's fine with me. I mean, mostly it was just a synopsis of where I am today and where I've been since I moved to Central Oregon with dental care. And then my very long, cumbersome grievance added to that. I'll apologize in advance if things don't make sense and there's spelling errors or grammatical errors or anything. But yeah, I mean, the story should be told. It doesn't do any good inside of me. It's the whole point is to be, I think it's helpful. You would get a concept that not everything's peachy. Sorry, is great for everyone. And it's, I think a lot of us that have dealt with dental issues, and not just periodontic, but dental issues, we've gotten the same, oh, we know that's a problem, we're working on it. Well, after years, that just, you start losing trust. And I think one of the things that being on these various committees is supposed to help is we rebuild the trust in patient and medical and dental health care. So we're moving forward in a positive way. Yeah, absolutely. Share it up. Anybody who wants it, it's yours.
Thanks, Teresa. And for those who might feel in the dark, it was just us, not just. Teresa shared her experience with the periodontal care, accessing periodontal care. And it's something we've been talking about, and it's it's our top emerging issue. And then, but she put it all in writing, and I was able to share that with the board of directors of the Health Council last week, and everybody there took it very seriously. And several steps have been put into motion. I think Don's going to talk a little bit later about that motion and those steps. But Teresa is also aware of most of those steps, I think, at this point. And hopefully connections are starting to be made between the providers and people in decision-making positions and you, Teresa.
Good.
So thank you again. And so I guess the CAC, Michaela, that hasn't been shared with the full CAC, right? Teresa's story, the written story.
No, it hasn't.
Okay. So since she's up for that taking place, we can do that. Send through email. Okay.
Okay.
Yeah, we're going to need to have a discussion internally because our email is not encrypted and it is considered PHI, which would be a HIPAA violation for us to send anything with a name in it. We do have a redacted copy though, so I just need to take another look at it and make sure that we don't fall into any legal problems. But I think we've redacted enough, Teresa. Even with your permission, it's just not safe. So I'm just going to make sure it's still redacted, and it may look like it's somewhat cryptic because there's no names in it. But we'll do our best to get it out to the CAC.
Okay, and it doesn't matter that my name's not in it, or it's not like I'm looking for recognition. It's just, it's important that people who can make a change get it. And it's also, if that's the purpose of this committee, is to make healthcare holistic and kind of patient center all over the place, then they should have that story.
Exactly. And I so appreciate you being willing to share.
Oh, absolutely.
Yes. Okay, the next item is the vice chair nomination. So Larry Kagosic is stepping down as vice chair. He's just a busy man. He's been the vice chair for as long as I can remember. I don't know how many years, those of you who do know, but many, 5, 6, 7, 8, I don't know. So we want to thank him for his service to the CAC and to the health system, to the community, the region. And welcome nominations for the next co-chair or vice chair. This is the right term. So anybody who would like to step up as vice chair, we do have that description of roles in the packet. So take a look at that. If you have questions, reach out to the staff.
I'd like to volunteer for that. Elizabeth Schmidt. I've read that description.
Okay.
I've been a CAC member since 15, so I've been around.
Yes. Thank you,
and
Elizabeth.
I have time. I do have time.
Okay. And what is our process, by the way, staff?
Yeah, so we'll send out an email and gather interest from CAC members, and then the CAC will vote on the vice chair position.
Okay. Great. Well, thank you, Elizabeth. Sure. And if anybody else is interested, you can either speak up now or you can let Michaela know offline, through email or phone, text, any way you like. But anybody who's interested is encouraged to do so. All right, and if you have questions, ahead of actually saying yes, I'm interested, that's of course welcome. Let's move to update on the board of directors and CAC actions from the combined meeting. I think that's you, Donna.
Yep, back to me. So I kind of wanted to level set the group today back to the combined meeting that you had with the board, and how there was some prioritization of really what you wanted to do and next steps alongside the board. And so I'm actually just going to touch the first 3. There are 6, but just the first 3 for today. So the first one was joint meetings every 3 to 6 months with meaningful, purposeful agenda and dialogue. This is scheduled for our January meeting. We're hoping that it's going to be sort of in person, and we are behind the scenes and putting that together. And right now we're not looking at a full combined meeting, although we're not opposed to it, but I'll give you more, I'll report more on that next time. The second, which actually there was 2 first, so it's not really a second, but it's 2 first. CAC members' own patient stories at monthly board meetings and focus on reality. We're going to come back to that one. And then the third one was enhance inclusion with increased quantity and quality of interactions, AKA, also known as structure, between the CAC and the board. So I kind of wanted to frame that so that you all recognize that we as the staff and your support systems are actually following the things that you've asked us to do. So already talked about the first, but the second first, again, I just wanted to commend Teresa on her courage and bravery in putting that out there. And one of the things that we want to be super responsive to when someone is that authentic, that we take that seriously and we actually do something. We don't just listen. But I can tell you, and I agree with Brad, and Linda Johnson was also there at the board meeting. The story was taken very much to heart by each and every board member. They were very touched, Teresa, very touched by it. And so much so that we've gotten quite a bit of feedback already. We have feedback from Pacific Source and of course from Dr. Gary Allen with Advantage, and he has such a heart for patients anyway. But we really wanted to speak to 3 things that were pulled from that. Of course, there was your personal experience, which I don't know that anybody, we can't go back in time and fix that, but hopefully going forward, there's lots of things that can be done. But the questions around why aren't there enough dentists in Central Oregon? Why aren't there enough periodontists in Central Oregon? And then maybe the one that I can speak to the most, at least from the Health Council perspective, is what's happening about integration with, primary care, behavioral health, and oral health, where we're recognizing and continually recognize that connection between those 3 is so incredibly important. I couldn't have set your story up better to speak to all those 3 as far as integration. So again, thank you for that. One of the things, and I don't think it's happenstance, I think it's the really hard work that the community does in recognizing the needs that are brought forward in our regional health assessment, which it translates into the regional health improvement plan by no accident. But an RFP, or request for proposal, for exactly that around the behavioral health, oral health, and primary care went out the day after the board meeting. And we were like, I don't know, maybe we were just reading the tea leaves.
So what is that exactly, an RFP?
So what that is there's been a request put out to Central Oregon, primarily to providers of any sort, that can come forward and show us a pilot or something they'd like to do around creating integration between those 3 modalities. So they would speak to triggers for anyone in behavioral health space. And of course, there are a lot of triggers with folks in the dental space, right? Because most of us, at least people from my generation, my only interaction from a dentist was not very fun. It was usually a drill in my mouth. And I came from a family of scarcity. So we didn't go get checkups or have cleanings. It was just when our teeth were falling out or we had a broken bone or were bleeding, did we ever go for care? Right. So I think that there's a lot of work that needs to be done in that space, but also that integration with primary care. So it's not just you're a dentist and your behavioral health and your primary care, but your primary care is speaking to each of those disciplines, and we call them disciplines in the different types of service, right, that bring it back so that they know the whole person. So there is a request for proposal out there today for someone's, we're hoping that it's actually a group of folks that come together and also use our newest technology around Connect Oregon, which is the community information exchange, so that they can all hold hands also in the social service area, which would be, food and housing, resiliency and belonging, and things that are that Central Oregon just has so much opportunity for. It's just connecting the dots, right? So again, I want to say thank you because your story is just setting us up really well to do that.
Can I say one thing?
Of course. I think
at the top, one of the problems that I really saw is that between departments, be it Pacific Source and then say Capital, for example, and then Gentle Dental, for example, and then my primaries and blah, blah, blah. I assume the information about me as a person, especially is there. I have told so many people, I have flashbacks. I need nitrous. I need this. I'm assuming it's there. I think that should be checked from whoever in charge. But I'm not sure, even if it's there, that they take the time to read it. And I think it's even harder in a system where you get passed around. It's a different dentist, it's a different hygienist, it's a different doc, it's a different, and you're just getting passed around, which happens more so when I think you have public health as opposed to like a healthcare that's private and blah, blah, blah. Because I don't know why you have to explain things again and again and again and again, and people to be totally oblivious. So
Thank you for
it feels like that. So I think there's a disconnect between everything, and that when I talk to whoever, they seem not to know what goes on beyond their own little cubicles, so to speak. Which I think if Pacific Source and OHP really wants to be what's written up in their mission statement, they've got to integrate the staff with each other too, somehow. And I know that's big and hard, but it's also, you've got to have a clue what's going on. And say, if you're Pacific Source, like for example, we pulled up, I'm asking for periodontist, he pulls up Google's periodontist in Bend. Well, there's 16 in Bend, but none of them take OHP.
Right.
Why that is probably because it's very cumbersome to be an OHP provider. I don't know. I'm just basing my information on years of asking, and then I'm drawing my own conclusions. But I said to him, well, I don't think anyone takes OHP. And he's like, oh, let me call. And he's like, oh, yeah, they don't. He called one or two and then gave me the list. Anyway, that's just a point of not really knowing who does what and integrating it. So they're not frustrated. We're not frustrated, blah, blah, blah.
Well, I appreciate that. I'm really hoping that in the not too distant future, you're going to be able to come back and report to the group what's changed and who you've heard from and what you're hearing is being done. So I just appreciate you being so candid with us, Teresa. I did want to just mention a couple of other things that I had heard in the combined meeting that I really do believe that your Central Oregon Health Council board is taking very seriously is the voice of the customer, and that they really want to know. And I know it's cumbersome and I know it's hard and I know it's telling your story again, but I just want to encourage you all to follow Teresa's example and bring things forward. Otherwise, we're not going to know, right? So those are kind of, I would say that Dr. Gary Allen did write a rather extensive email that we're just trying to make sure that it doesn't have any things that we wouldn't want public facing, only because we want to protect privacy of our clients. But I will hopefully be able to forward that, if not in a redacted format soon, so the CAC can see a formal response to that, which was pretty incredible in my opinion. The other thing I wanted to mention, and it was kind of mentioned a little bit at the top of the call, because I think some folks have seen it, but there was a press release that went out yesterday. You all should have received, that announced my retirement. And that will be no later than the end of June of 2022. I'm going to do some practice retirement next week with my 5 grandkids. And I'm going to see if I really like it. And, hey, I may redact that. I don't think so. No, I have, my husband and I have spent our whole married life raising children. We have 5 children between us. And so I've never really been able to show up as a full-time wife or mother for that fact, or grandmother. So I think I'm going to give that a try and see how it goes. So it's going to be really hard. And we are actively recruiting for the position, and we have a recruiting committee. So if anybody actually wants to throw their hat in the ring or give me a call and chat about it, I am happy to do that. And it has been my absolute pleasure to serve you all, and I'll still be serving you for some months to come. So you still get to take care of me. Thanks, Brad. Back to you.
Thank you, Donna. Yeah, we have several months to give you your parting niceties and so forth. Thank you. Before we move on, Myra joined us. Myra, would you like to briefly introduce yourself?
Sure. Sorry about being late. My name is Maida Benitez. I am a CAC community member and community volunteer.
Fantastic. Gracias, Myra. I think that gets us a quorum, yes? All right. So I just noticed, I should have noticed probably earlier, but I just noticed we didn't have the minutes in our packet. Not sure if others noticed that.
I apologize for that, and everybody should be getting an email with that attached to it.
So we can either bring them up on the screen now or we can vote on them later. I think I would, since we're already a little bit behind, suggest that we vote on them later, unless there's something in those minutes that we need to actually give our attention to. Don't remember, are there been any actions in there that we want to follow up on? Those...
The actions were basically responses to emerging issue questions.
Okay, so we'll be covering that later. Alrighty. How did the other CAC members feel about moving on and voting on the notes? Sorry, the meeting notes from last month at the next meeting? Yeah, thumbs up, thumbs up. Anybody not crazy about that idea? Who would rather? Okay. Let's go ahead and move on to our breakout groups, breakout sessions then. My favorite part of the meeting. We're going to break out for about 10 minutes. The CAC members are going to break out into small groups, and it's a time for us to get to know each other on a different level and get comfortable with each other. And the other, remind me, Michaela, what happens to everybody else? You guys hang out here in the main room?
Yeah, so CAC members will go into small breakout rooms, and the guests will also go into their own breakout room. And Kelly, would you mind telling everyone what the question is?
Yeah, the question for today that you are more than welcome to discuss is name one person you are truly grateful to have in your life. And I will send everybody to their rooms.
You only get one?
You can have more. Everyone should be back now.
All right. We're going to need to, hopefully everybody really enjoyed that. I sure do every single time. And I'm going to assume that you all did too. We don't have time to hear everybody's input, unfortunately, because we're already a little bit behind schedule. We need to dive into the community health projects and updated news and making, we still have a tough decision to make though. So some of the work's been taken off of our shoulders and some new work's been put on. So I'm going to pass it over to Michaela.
Got to unmute myself first. All right. So exciting day today. So today you get to make your final funding decisions on your 2021 community health project grants. So yay. So we know this has been months in the making, and we know this is a lot of work and consideration, and you invested many hours towards investing these funds to benefit your communities. So we want to thank you for that. So just a quick refresh. So the Oregon Health Authority mandates that it's the CAC's responsibility to determine how these funds are spent. And these funds have to go towards projects that address social determinants of health and health equity. And then furthermore, back late spring, you as a CAC decided to prioritize projects that serve rural areas and marginalized communities. So you released a request for letters of interest, asking interested community organizations and tribal nations to submit an overview of their projects. And you as a CAC reviewed and scored 30 letters of interest and invited 10 applicants to fill out the full application. So providing more details about their projects for you to consider funding. So last month we sent out all 10 of those applications, and we asked you to read and rank those applications. And in the meantime, we received additional about $317,000 through another funding avenue called the Quality Incentive Measure funds. So you were notified by email of those extra funds, and those extra funds would be enough to cover all 10 of those applications that you're reviewing, plus some. 7 of you went ahead and submitted your ranking and feedback on those 10 applications. And that survey, those survey results are in your meeting packet, as well as Kristen Tobias created a summary of all 10 of those applications for reference. And those are also in your meeting packet. So I want to share a spreadsheet with you. Oh, whoops. There we go. Okay, so I wanted to go over this spreadsheet, but then also have a conversation about funding these 10 applications that you received. And then separately, Gwen will take you through another conversation around how you'd like to consider investing the extra funds. So going over the spreadsheet. All right, I apologize, it's a little bit small. So on the screen here, you see all the 10 applications or applicants that filled out the full application. The first column is the organization's name that submitted, plus the Confederate Tribes of Warm Springs. The name of their projects is the next column. And then column L is how much those requests are for, how many years that project spans, what's the breakdown of funding per year, and then lastly, on the right-hand side is which communities those projects serves. And so
Michaela?
Uh-huh.
Buffy, I don't have what you're seeing and I can't see it. Can somebody send it to me, please?
Yeah, sorry about that, Buffy. Kelly, would you mind emailing Buffy and then anyone else that's on the phone today? Thank you for pointing that out, Buffy. I apologize. So looking down, down towards the bottom, this is the math breakdown, just so you can see it. So you start out with $431,000 of community health projects funds, plus the additional QIM funds, which is around $317,000, gets you to about $748,765. And if you fund all 10 of your applications, the remaining funds would be just over $60,000. Any questions on that or anything I've mentioned?
Michaela, this is Donna. I just want to be sure that that 431 includes the 61 from the previous year. Remember we had that carryover?
Yeah, so this is, so the 431 is community benefit dollars. So from, and that's, yeah.
That would include the 61. Thank you. Just wanted to be sure.
Last year's QIM. And so we just combine that and call it community health projects funds.
Okay.
And
Thank
that's
you.
the number that we've been giving you all year. Other questions?
I have a question. In the last columns, what does it mean that some of them are blue and some of them are not highlighted?
Good question. Kelly, do you remember why they're blue?
I do not. Kelsey did that when she was still here, and I do not recall why those are blue.
I'm sorry, Mandy.
Was it either the equity question or the rural question? Maybe equity?
Oh, I can't.
I don't remember either. Yeah. So we already got the X's for geography.
Yeah.
And equity and rural were the other two big kind of measures that we had the same question, Mandy. So are there other questions? Sorry, from CAC members?
I have a comment. I was in a meeting I came in the end, and Linda was in that CAC meeting with Tom Coswell. And because we saved the government a lot of money, we're getting a reimbursement of a lot of money. We saved $1 billion. And so that's going to be dispersed here. So, and one of their considerations is the underserved, which would be Warm Springs. They'll get a lot of money. It's all just happening. I think the state's going to have a committee. I don't know. Do you all know about that?
Rebecca or Donna?
Yeah.
It's a part of the waiver request. And as I understood it, yes, Elizabeth's correct that Oregon saved the federal government $10 billion. I didn't get the sense, Elizabeth, that it's coming back to us immediately, that the waiver request will direct how the funds want to be spent and used and directed.
They mentioned, though, the underserved, and
right.
I think it was definitely the tribes are going to get some serious money.
Right. And they mentioned social determinants of health.
Right.
As well.
I just came in at the very end, you know.
So it sounds like separate funding, and we might need to get more details on that.
I don't know if Rebecca has, there's no read on it as yet, and it is in a waiver, and a waiver is simply a request to the Centers for Medicaid and Medicare Services to consider what we might want to do. So it's not written in stone. And the other thing that people forget about the waiver is that it's, our state's doing the best they can to include everything they need to do so that we can be flexible in what we do, but it doesn't mean they're going to do that. It means if we do that, is it okay with the federal government? So we just have to keep it in perspective, and I will definitely keep you updated. And Rebecca, hopefully not stepping on your toes on that story.
Okay, so coming back to kind of the discussion of, you have 10 applications and you have enough funds to fund all 10. I want to hear some kind of gut reactions to funding all 10, what you like, if there's any concerns from the group, just kind of opening the floor.
One first question I have is the 5-year project timeline for the Confederated Tribes of Warm Springs Sheltered Independent Living. Is our timeline, in fact, 5 years? Most of what we've seen has been 3 years or less.
We don't have any time requirements. It can be as long as it needs to be.
Okay, so if we allocate it this year, even if it's spent over 5 years, it's considered spent.
Correct.
Okay, great.
Hey, Michaela, it's Connor. Have we considered readjusting the max limit that these projects are requesting now that we have extra funds, or are we still capping it at that $80,000?
That would be good thinking, good thought. Connor, would you mind if we save that for kind of the second part of the discussion of kind of like what to do with those extra funds?
Oh, sure. Sorry.
So if anybody else wants to speak up, go for it. Otherwise, I was going to just try to clarify. Let me ask one more time. Does anything else? Any questions, comments?
Just one question in terms of process. We have the 10 that we've approved. If we have leftover applications, do we want to look at those that didn't get approved? Is that one option, or are we being asked to think about how we can enhance the existing 10? I'm just not clear about what we're being asked to make a decision on.
Yeah, so the first part of the discussion is kind of, with these 10, do you want to fund them, as they are? You have the funds to do so. And then the second part of this discussion, which we'll talk about later, would be, okay, you have these extra funds, what would you like to do? And kind of considering that. So kind of, I want to get your thoughts on first, around funding these 10 applications. And if there's any of these that brings up concerns that we wouldn't want to fund all 10, to do so and to talk about that and explore that before talking about funding all 10 of them.
And Michaela, it's Connor again. I remember reading as we went through the voting process that one of the projects, I think it was the Confederate Tribes of Warm Springs, was likely considered something else, but we were still to vote on it.
Mm-hmm.
Is that, are those funds are still coming from this 431?
Correct.
Okay.
And it's
Yeah.
reflected in the spreadsheet, right, Michaela?
Yeah. Yes, it is. And the total funds, the total pool has grown to 748.
Mandy, yes. Yes, what are you saying yes to, Mandy, if you don't mind me asking? That you support the 10?
Yes, and I was just gonna provide initial reaction is yay, because it was really hard to make this decision, and I love when it works out that everybody gets funded because they're all important. And I was answering Gwen's question in the chat.
Okay. So if there's, this is the time to bring up any concerns. This is really what we're looking for, I think, is, and Michaela already said it, but I'll reiterate it. If there are any concerns about any of the 10 projects, meaning we either don't want to fund one of the 10, or we think they should get less than what they've asked for, I see those as the two kind of considerations. And then discuss, what those concerns are and why. Otherwise, I think we're moving forward with voting on the 10 as presented. But I want to make sure that there's opportunity to speak up. Anybody can speak up on any concerns.
I have a question in reviewing the projects. We normally don't approve bricks and mortar. Doesn't mean we can't. With the Safe Haven parking project, is there anything in that project that would make it different from our past practice of spending for bricks and mortar? I know it's for housing and safe place for people living in their vehicles. I support the concept. I just want to make sure that we're not violating by some or contradicting ourselves by saying we don't approve bricks and mortar. And in this case, it could be interpreted that way.
I can sort of speak to that too if you need any. It's providing case management, porta potties, hand washing stations, and meeting those guest needs. So they're not building anything. They're just using parking spaces set aside typically by churches.
Oh. And they're providing utilities basically for.
Yes.
Okay.
And a safe place so people know when they
Got it.
return to their vehicle and park there, no one's going to wake them up and ask them to move.
Okay.
And
Yeah,
then they get
familiar with
case
the
management and
concept.
wraparound services.
Thank you so much.
Yeah.
That helps.
And then this is Buffy. I just have a point of clarification. And on the final submitted grant from the Confederated Tribes of Warm Springs on the shelter to independent living, they changed the time frame from what was 5 years to 1 year. So that would be allocation of the total amount in one block.
Okay, thank
Very
you.
good to know. Yeah. So any other questions and or concerns? Any specific to, again, not anything that would cause you to not want to fund one of these 10 projects or not fund them fully? Okay. Because if not, I think, is it appropriate for us to vote on funding the 10 at the levels presented, and then we move to the second, the additional funds available?
Yes.
Okay.
I move adoption and approval of the list as presented for funding.
So, and I think I'm curious, Brad, did you want to use the 5-finger voting approach?
Yeah, we can do that. So after the motion, so Linda has essentially said yes, let's.
I'll second that motion.
All right. One more chance for, Connor's given 5 fingers in the chat. One more chance for any comment, discussion. Okay. 5 fingers, 5. Is everybody clear on the 5 fingers? 5 is absolutely yes. No reservations. 4 is one step down from that. But definitely a yes. 3 is also a yes, but maybe some reservations, but you're still a go. 2 is, you guys are gonna have to help me out. 2 is still a yes, right? 1 is the only one I can remember that is actually I can't go for this.
Or 0.
I'm a 5.
Okay.
2 is some concerns, but we'll go along with it.
Okay, so we have Teresa 3, me 5, Ken 4, Connor 5, Elizabeth 5. Who else? Mandy, do we get a? I'm sorry, I can't see chat. I can see it, but I don't do that very well. Mandy 5. Sorry, Mandy. And do we have everybody? I think we have everybody. Do we have everybody's vote?
I believe so.
Yes, everybody has voted.
Okay, fantastic. So I think we had everybody 3 or higher, which means we move forward with approval, correct?
Yes.
All right. Thanks, everybody. It's a lot of work to review these proposals, and appreciate everything you've done. So, Michaela.
All right, I'm going to hand it over to Gwen to talk about the remaining 60.
Yes, so this is where y'all are ready to go. So we're going to move in that direction. So you have an extra $61,000 that needs to be invested equitably into the community health by March of 2022. So you have a little bit of time, but not a lot. And I know everyone comes with a lot of different insights today. You come with different viewpoints and opinions about what might feel right or be right. And so as we go into this conversation, we just ask that you respect and honor and be gracious with each other during this conversation. We're just going to do some exploration today around options. We don't have to make a final decision today. We just need to know what our next steps are. So this is very much an exploratory conversation. Does that make sense? Any questions about what this conversation is about? You can ask again anytime. All right, so we have 60K. Let's start. I have a series of questions. So I'm going to ask you to kind of hang with me as we go through one question at a time, because we're going to explore this from a couple different perspectives and then come back around as a group to identify maybe some options we want to land on or have a formal vote on at some point in the future. Okay, so the first question is, let's just do some idea generation. What are some ideas that y'all might want to consider about what to do with this extra 60,000? No, Teresa, I see you talking, but you're muted.
Because I talk out loud all the time to myself. That's why I mute myself. Look back at the other applications that didn't make it through the cut. So that would be 20.
Sounds great. All right. Other ideas? And I'm just gonna have you popcorn them out.
Mandy has her hand up.
Thanks.
So I'll just share the strategy I used when I was trying to choose the top 3. And I really focused on the projects that I felt were going to save lives.
Great. Stacy, would you like to share your idea?
One of the organizations that I've actually done some recent research on is TRACE, which is trauma resilience for, oh my gosh, adverse childhood experiences, which really helps children, and then it has a domino effect of helping into their adult life, if anybody is familiar with ACEs.
Yeah.
What are some other ideas from CAC members?
I think like Teresa, like look at other applications that didn't make the cut and see if we can provide some support there, or give a little more to the ones that are already, the 10.
Bethlehem Inn, their budget was incredible. They only asked us for a small portion of their budget. And I really would like to give them some extra because they had an outrageous budget. Wasn't it $1 million or something?
Which one are you talking about, Elizabeth?
Bethlehem Inn.
Bethlehem Inn.
If you look at their budget on the back sheet, they have an incredible budget and they only ask us for a small amount.
Before we get into specific organizations, let's keep looking at that high level approach. But hold on to that, Elizabeth. We'll eventually come back there. Teresa, I see you.
So this is an out of the box thinking attitude. So a lot of the things that we funded really dealt with our really at risk population, homeless, etc. And that population. So if I offend or anybody, I apologize in advance. One of the things that I look at when looking at the big picture is the levels of social economic classes, because that's really what creates culture. So economics does create culture. But one of the things that we have to do, I think, in a big picture, kind of like climate change, is keep focusing on, as much as we can, saving and creating the middle class and helping the middle class. Because the middle of the class is, in my opinion, the class that makes things like this happen. They have the time. They're not working 24/7, 3 jobs, and they're not so rich, they don't really care. That's very stereotypic. Apologize for that. But so one of the things that I noticed, and I'll just throw it out as an example, that one of the applications was CORE, which is really looking to creating opportunities for the middle class to have home ownership. So, I mean, there's a lot of organizations that are focusing on the middle class, a lot that are the lower class. So the out of the box thinking that I'm trying to do is just looking at society as a whole and not just focusing on the homeless. I just want to put that out there.
Thanks, Teresa. Linda, and then I see Brad, and then I'm going to do one more ask for ideas, and then we're going to move on to the next question. Okay.
So the council, I like where Teresa's going with thinking about the bigger picture. And I had 2 thoughts. One is just, it's a tiny one, and that is in our work to identify emerging issues, is there a need for a piggy bank to spend some money if an emerging issue needs money that there's no other allocated? That's the small one. The bigger one that's out of the box is, if our commitment as a council and as a CAC is to diversity, equity, and inclusion, could these funds be targeted towards a community awareness of equity and inclusion? Because when I read and I listen to people, and it's particularly the homeless issue right now, people are pretty charged. And some of it, I want to believe, is because they're not aware, they're reacting. It just, I don't know, I just raise that as a big picture thing. Could we put some money into equity, education, or awareness building in our community? The long-term impact could be more people participating in a solution.
Thank you, Linda. And Brad?
Yeah, I just wanted to touch on the suggestion that we possibly give the 10 more funds and just share that I'm not in favor of that. Basically because the RFP had a limit of 80,000, and I think it's not right to, change the rules, so to speak, after the fact, just because we have extra money. So I just want to put that out there.
Thanks. Which actually, can I see you unmute? Leads us into the next question that I want to ask is, what are some things that you don't want to consider that are really outside of scope? But I do want you to refresh your memory that there are some requirements about where and how these funds are spent. So just refresh on that. So that's the question that's out there. Ken, I imagine you might want to respond to Brad and or answer that question or offer something else.
No, I had a different thought. I would never contradict Brad anymore. Not in public. I was thinking about the harm, if you will, that kids have suffered. 60,000 is a spit in the bucket for what I would like to think about the helping out schools and particularly like counselors that are working with traumatized kids and traumatized families is the one in particular I think would love to see some more work done there.
Thanks. And then I think, Mandy, you raised your hand, and Connor, you had brought up some ideas earlier on. So I want to, and some thoughts earlier on. So I want to make sure we circle back and put those in this conversation. But Mandy, would you like to share first and then Connor?
Sure. I just want to speak to what Linda said. There's already some groups working on that. So I would love to talk to you offline about that education and awareness thing. So that's all.
Thanks.
And from my perspective, I guess I don't know where the 80,000 limit was regarding the RFPs. And so my initial thought was we originally selected 10 down from 30, and there was probably a reason for that. So I didn't know if we should go back to those 10 and say we have this extra money. Did you max out because of the RFP, or could you use more? That was just my thought.
Right. Okay. I'm going to resurface the question of what are some things that you don't want to consider that just seem off the wall? Like, we're not going to fund a beer garden for this. Maybe something a little bit more in scope, but like what kind of things are off the table for this that you're not willing to consider? I see Teresa unmuted and Linda unmuted and Mandy shared a comment. So
I'm not sure I understand the question. Sorry.
no, that's okay. So is there anything that you want to look at as saying, I am dead set against not funding, or I really don't want to do it this way? Like I only want to pull from existing projects that we've seen, or I only want to fund, I think we should, based on our requirements, we should only do these types of projects, something like that, or think we shouldn't do this kind.
I don't think, or I personally don't want to fund the ones that, the 10. I feel like we funded them. I feel like the process, well, let's not go there. We funded what they asked for, and I think we should say, here you go, congratulations, and then look back at the other applicants.
Great. Thank you. Linda and then Mandy.
I'm okay with, or this is what I'm not okay with, right? I can't think of anything that I'm not okay with at this point, unless it's outside the bounds of legality.
That works. Myra, Connor, I just want to give you an opportunity to weigh in at any time.
I'm still trying to think.
Fair enough. All good.
This is Brad.
There's nothing specific that comes to my mind. Sorry, Brad.
No, go ahead.
There's nothing specific right now that comes to my mind that I wouldn't fund or wouldn't want to fund.
So great, thank you. And Brad?
Yeah, just because maybe this is where the question's coming from. There was some offline conversation about the possibility of funding a project that wasn't one that had actually applied in this round. And so I just, if we need to, if it's helpful to make that a public statement, I'm not comfortable with that, like considering organizations that didn't actually apply in this round for these funds.
Mhm. All right, I saw a thumbs up. I'm just checking it on. We have about 10 minutes left to the meeting, so I'm going to kind of move forward to the next question. What are some of the implications for the ideas mentioned? So you've mentioned pulling from existing LOIs. You've mentioned some other projects that haven't applied. You've mentioned some preferences around projects. So what are the implications of some of the different options? Like downstream, you know, what are the implications of our process, our timeline, those kinds of things?
I'm not sure if this qualifies as a on that as an implication, but the proposals were submitted a fair amount of time ago, and so one of the possibilities is that we might look at additional proposals whose things have changed. They've already gotten their project funded. The conditions have changed. So if we go that route, I think we need to take a look at, is this still current and viable and needed?
Mm-hmm. Great. Thank you, Ken. And Michaela put in the chat the ideas that you all have generated from the last few minutes. So take a look at the chat if you haven't. Go ahead, Brad.
Yeah, one thing that I just feel is really important is, you know, had we started out with 700 and whatever the number is, the money that we have now, we would have chosen more than 10 organizations from those who applied. I feel 100% confident in that. Maybe others don't agree, but I feel pretty confident because there are other great projects, and the only reason they weren't chosen to submit the full application is because we were already, even the 10 was more than the money we actually had available at the time. So we were kind of stretching at that point, which I'm happy we did because it worked out nicely. Because of that, and because there was a process and several organizations applied with worthy projects that just didn't make that cut because of the funding restriction, limited funding, that we really need to stick to those who applied already. And yes, I absolutely hear what Ken's saying. We're going to have to possibly go back and, depending on where this takes us, ask those organizations, are they still in the same place? Have they gotten funding and they don't need it anymore? You know, questions like that. That's very valid, Ken.
I saw someone unmute. Was that you, Teresa?
And I muted again, so I'm just thinking, I'm not sure. I'm in that process where my brain is whirling around it, so.
So let me ask this question to kind of pull things back together again. Is given the discussion thus far, this what we've had in the last 20 minutes or so, what are some of the options that are open to you?
This is Connor. I agree with a lot of what Brad and Ken have said in the last couple of minutes. So I would like to stick with the ones who have proposed or did an LFP, and we look back at them and try to fund outside of the top 10 that we picked.
Mm-hmm. Thanks, Connor. Other options? Mandy, I see, and Myra, you're agreeing in the chat. So options available to you for moving forward. Go ahead, Brad and Teresa.
Go ahead, Teresa. Oh, you're not ready. Okay. So we did score, we did evaluate, not all of it. We didn't all evaluate all the proposals, but the CAC did evaluate all the proposals as a body, and we did score and weigh them, correct? So we could, I mean, one idea that I have is, that seems sensible, is to look at all the other proposals outside those 10 and which ones rose to the top in our evaluation, and see where that leaves us. You know, is there one at the top that's right around 60,000? Is there two at the top that, you know, could fit into that 61,000? What does that look like?
Brad, if I could modify that a little bit, rather than review all of them, how about if we review the top 5? The ones that were ranked prior, and rank the top 5 rather than go through all of them. Is that possible?
Oh, and just to clarify, I was not recommending we go through all of them again.
Oh, okay.
I wouldn't do that to any of you or myself. No, yeah. So actually what you just said is much closer to what I was saying, which is, could we look at, you know, are there 2 that rose to the top? Or maybe we do need, as you, I think, suggested, Linda, maybe we do need to open that up a little bit and look at the top 5, since not all of us evaluated all the proposals. That could make a lot of sense.
And are we pulling those top 5 based on the scorecard that we used in the beginning of the process? Is that what you're suggesting, Brad?
Yes.
Good. I think that would be smart, because I think it's pretty objective.
So I want to check in with a couple of folks that we haven't heard from. Elizabeth, just want to see, and Ken, how are you all both sitting with the option of pulling a couple of the top ones and looking at those?
Well, I just had a question. I can't remember, I'm in several groups. Didn't Gilcrest in that area down there, did they have a proposal? Geographically, those people down south need some help. I don't know if there is a request in that form, but I really am concerned about those people below Pine.
So kind of looking at on regions that haven't been served in this grant cycle, in addition to maybe the top ones.
Right. I just would like some money to go down there. I think their grant writer is not adequate, and I think they lost out because of that. I mean, but there are so many needs down there, and those people, but it could have been a different group that I was in. I mean, I'm kind of blanking as to what the additional, grant requests were. It really takes a lot of time to think about this, do some research.
Yeah, and we can prep some stuff. Go ahead, Ken. I'm going to let you weigh in, and then.
You said, I thought what Linda and Brad were suggesting is a good pragmatic approach. Again, $60,000 is not insignificant, but it's not a huge amount of money, and there's something to be said about how much work we want to put into that.
So let's go ahead. We are down at the last 2 minutes. So let's use our 5-finger voting. Can somebody project that from the agenda? Just to see where we all are on page with pulling the top 2 or 3 LOIs to look over again. And if folks can put in the chat or say out loud or show visually kind of where we're at, to confirm that this is we're okay with living with this to move forward. Brad, I've got a 5, Ken 4, Teresa 5, Elizabeth 2, thank you. And then Mandy 5, Connor 4, Myra 5, and Linda 4. Okay, so we're in fairly decent consensus to move forward with that. So then I think with that, staff will come back to you in December with what you're talking about. We'll pull from those LOIs and that recording. We'll talk about whether we'll be sending you stuff out before the next meeting, so the next meeting is spent in that discussion, just because we do have the deadline we need to meet as well. So you'll be hearing from staff in the coming weeks. But you've done a really nice job considering a lot of different things and already dedicated a lot of hours and time to investing and caring for your community. So thank you so very much. I'm going to hand that back to Brad, I think.
Thanks, Gwen. And thanks to everybody. Yeah, and Elizabeth, we're not going to forget about your comment either, just so you know. I think we have, yeah, I think we have space to remember that and consider that when we look at the whatever it is, the top 3, top 5. Because there's a good suggestion that we be mindful of South County. And any other geography that's been left out. So yeah, we are out of time. We did cover the emerging issue, the periodontal care emerging issue already pretty well. So we actually did cover that. The other one is chiropractic, and do we have a third? I forget. The third emerging.
2 to start with.
Okay.
We have more on the list, but those are the 2 that we're handling. And I know Kristen and Rebecca Donnell have been working behind the scenes on some things. We'll probably bring that back to you because it's going to require a little bit more time than we have today to come up with a proposal.
So we should have a robust response by the next meeting. All right. Well, thanks everybody. Is there anything else? We'll get to the order. Anything else anybody would like to share or say before we part?
I was just going to say thank you for all of you. I'm grateful for all of you, and I hope that you get some quiet time to reflect on your many blessings next week.
Thanks, Donna. All righty, well, enjoy the rest of your day. Thanks again for all the work on this.
Be well.
Thank you. Bye-bye.